صباح الخير. So do you have any question regarding the introduction to nutrition or clinical nutrition? حدا عنده أي سؤال؟ Okay, so before I share my slides, so حكينا امبارح about the importance of nutrition and how it's a vital component or considered as a vital component of quality of patient care, quality of patient life. Okay, I'm gonna stop accepting students to join us in the next 2 minutes. Okay, so the importance of nutrition also has a paramount importance to maintain our function and to achieve optimal health. So this is why we need to study deeply clinical nutrition and go over different nutrient requirements and how we can design a very healthy plate and how we can make nutritional recommendations for patients whatsoever. اليوم بدنا نحكي أو قبل ما أحكي عن موضوع الكاربس, there's two commonly used concepts and I'm متأكد you are very familiar with, اللي هم malnutrition, وبرضه ذكرنا امبارح food or diet labeling. Let me share my slides first. خليني أشوف. Okay, do you see my slides, everyone? Okay, good. قبل ما نحكي عن the importance of carbs, في مصطلحين أو خلينا نحكي شوي little bit about malnutrition, because nutrition is all about balanced food and eating adequate amount of nutrient. مصطلح malnutrition, like mal and nutrition, when you are receiving, or the patient or a normal individual receiving less than the required amount of one or more nutrients. Not only that, an individual could be eating more and more food, okay, but still we can call it malnutritional status. Why is that? Because the other part of the definition of malnutrition, if you are receiving imbalanced food, so you either not getting enough nutrient, one or more, like not getting enough protein, not getting enough vitamins, not getting enough minerals, or a particular examples of minerals, or you are eating, okay, like maybe large amounts of food, but you are getting imbalanced food. You are eating more of protein, less of carbs, more fat, more vitamins, soluble vitamins, but you are not eating fat soluble vitamins. You are only getting water soluble vitamins. So this imbalance creates malnutrition. And why it's important? It's very important to know these facts because it has several implications, like health implication, functional implication, and different real life scenarios. So once you do assessment with the patient, you're trying to see what they're eating, what's their diet or healthy diet regimen on daily basis, how they exercise, where they're getting these food resources from. You will be able to draw a good picture of the factors that might lead to malnutrition. Okay, maybe some patient lack B12 or folic acid, or have B complex deficiency, or they have like iron deficiency, or they are not getting enough vitamin D, or so you can do your own assessment based on your knowledge of the definition of malnutrition. برضه حكينا بالمحاضرة الماضية لما نشوف الفود label. Food labeling is very important. It reflects what you're gonna eat. Okay, قبل ما آكل الطعام أو قبل ما آكل أي شيء عليه food label, I can get a picture what I'm eating, how much serving size I'm getting. This is the first impression. Second, how many calories per serving size. ثلاثة, أنا بقدر أتحكم بالdaily value. So sometimes you need a very minute amount of cholesterol, so you get less than 5% of daily value. You need more of protein, you are focusing to get 15 to 20% of daily value. So this is how I can control the type of food I'm eating. Also, if you want to follow healthy diet, بتطلع على هاي الفود labeling, بشوف, okay, I want more fibers, I want less added sugar, I want no or almost close to zero of trans fat. Okay, شكرا ياسين. So you can tell how much you're gonna get added sugar, which is the least thing that we want. You're just eating more. This is a new concept called calorie dense food. Do you wanna eat calorie dense food or nutrient dense food? If you want a calorie dense food, you can just get sugar as much as you want. If you want a nutrient dense food, you can have carbs, protein, fat in a balanced amount. You can have also accompanied with that vitamins, you can have minerals, you can have fibers. So we always looking for a nutrient dense food rather than caloric dense food. So this is the thing that I wanted to focus on our introduction, why we need zero trans fat. Once we go over the fat chapter, you will see like there's two types. There is saturated fat, or there is unsaturated fat. We like saturated fat more or less. We like it, or we like our food to be more of unsaturated. Like it's gonna be liquid almost at room temperature. Liquid at room temperature. That means the saturated fat is kind of solid and it's associated with more LDL, bad cholesterol, associated with less HDL, good cholesterol, associated with more cardiovascular risk factors. So this is the saturated. But why it's saturated? Because single bonds are combining the carbon atoms. Like there's a skeleton of carbon, hydrogen, but there's single bonds between carbon and carbon. So you can stack them over each other. تقدر انت ترتبهم فوق بعض. فعشان هيك they're gonna be solid. unsaturated fat we can find double bond, triple bond. فبكون في عنا kinks, بكون في عنا ميلانات أو زوايا kinks. فما بتقدر ترتبهم فوق بعض فبضلوا عندي على شكل liquid. The problem of trans fat that we don't have it in our bodies. We don't know how to deal with it. طيب كيف بنتج from food processing؟ عملية الهيدروجينيشن. اوكي، عملية تحويل الانساتوريتد لساتوريتد بنتج عملية دبل بوند. اوكي، لكن هذه الدبل بوند بكون فيها كينكس، عفوا ما بكون فيها كينكس، بسميه ترانس فات، لأنه كلمة ترانس هي the opposite of cis. Cis you have two hydrogen bonds at the same side of carbon, while trans, okay, you have hydrogen bond at the opposite side. That means you can stack again this hydrogen and carbon skeleton over each other وبتحصل على برضه solid fat. But the problem is we can't deal with it because this is an outcome of food processing. Added sugar, ما بدنا added sugar. We can get natural sugar from eating fruit and vegetable. You always need to avoid added sugar. Fibers, we need at least 20 grams of fibers. It's good for your GI, it's good for preventing diseases. We will see in a few minutes. So this is more about the food labeling, which is very important. Everything I mentioned now is very important. I want you to revise it and review it and try to practice how to read this food labeling, and so you become able to master these skills. Okay, now what about carbs? ولما نحكي عن carbs, whether sugar, starch, fibers, احنا بنحكي عن again carbohydrate skeleton. High carbohydrate, very abundant around us. They're inexpensive, can be stored for a long time. Many examples around us: rice, corn, pizza, legumes, sweets. They are all contain carbohydrates. Simple, بدي اياك تعرف لي like examples: monosaccharide, glucose, نحكي fructose, galactose. بدي اياك تعرف لي examples of disaccharide like for example maltose, sucrose, lactose, and complex carbohydrate. Complex carbohydrate could be starch, glycogen, chitin. So I want you to get some examples out of these and memorize it very well. Okay. Now, in terms of complex carbohydrate, just 1 second here, we know that glycogen is stored in animal tissues, okay? So we can also store glycogen or extra glucose in our body as a glycogen, while starch is stored in plant, and we have fibers, which is the thing that we cannot, or the part of polysaccharide that we cannot digest. One thing about the glycogen, they have different, I don't know if there's a, okay, there's no picture. There are different branches in glycogen, so you also can stack it in order to store it. Where we store glycogen in our body, we store it in the liver, like in 100 gram. We also store it in our skeletal muscle. Okay, so once we need it, we can get it. So in our skeletal muscle, we have more than 500 gram. But as a concentration, we're gonna have more concentrated glycogen in our liver, okay? Because just due to the mass, you have more of a mass in terms of skeletal muscles. Dietary fibers, it's very important to remember these two concepts: soluble fibers and insoluble fibers. It's very important because this is kind of medication. This is kind of recommendation as a pharmacist you can give it for a patient. This is something you can treat people with, okay? So I want you to remember these two tables very carefully. We have the soluble fibers, example of that, where we can find it, and what are the functions of soluble fibers. You see, lowering blood glucose. Actually, soluble fibers is gonna like work as we call sometimes mucilage, okay, or some like kind of viscous material.
في دكتور بس سلايدات مش موجودة.
لعد انتوا كيف متابعين معي؟
بس مكتوب انه الشباترز مثلا the carbohydrates, the lipids, clinical nutrition، بس هذا الموجود. الامينو اسيد بروتين بس هيك موجود. هاي chapter 4 the carbohydrates PDF.
لا انا فاتح الكربوهيدرات وبشرح عنها.
مش طالع عنا غير بس الصفحة هاي. يمكن نعلق الجهاز او شيء.
يمكن. طيب خليني ارجع اعمل ستوب شيرنج وارجع افتح مرة ثانية. اوكي؟ يلا.
تمام دكتور، تمام.
احمد هلا طالع؟
لساته دكتور مش طالع إشي.
لا دكتور بعده.
طيب شو بكون المشكلة هنا؟ طيب خلينا نشوف one more time. Okay. Okay, I just resume it. So
يعطيك العافية.
yeah, please remember these two tables by heart لأنهم بيحتووا على ال functions, sources, differences between soluble and insoluble fibers. Can you scroll down شوي أحمد? Okay, more and more. Okay, stop here. So on the other hand, insoluble fibers, they kind of increase fecal weight. So they are good for what? For constipation, for GI symptoms. In general, like fibers in general, they are good for your health. Okay, حكينا they are good for colon cancer. They reduce the risk of colon cancer. They good in terms of non-caloric. They are non-caloric, right? There is no calorie out of fibers, and different advantages in terms of the cardiovascular protective effect. They have a good effect on terms of patient who have diabetes, a high cholesterol level, a patient with GI sign and symptoms. They can use fibers. And now scroll down a little bit. Now, of course, you can't eat. No, go down a little bit. You can't eat more fibers. You can have as much as you would like to eat. حكينا إحنا that's why we need the daily recommended intake. How much I can eat it to keep myself like healthy and wealthy. حكينا up to 20 gram of fibers is very essential. You know, أحيانا you may go up to 30 if the patient they have some comorbidities and they can benefit out of it. But ليش we cannot go more? Something doesn't give you calorie, okay, ما في calorie and it has good health advantages. ليش أنا ما بقدرش أكل as much as I would like? Because there's some disadvantages. Okay, you can't go over the limit that you cannot really withstand. It can interfere with zinc, calcium, different minerals and vitamins. So you have to keep this in mind. If the patient بده ياكل fibers كثير and be taking, for example, multivitamins or taking some minerals, so you need to do spacing. So you have to keep this in mind. This is very important. Also, besides, it causes some flatulence and some intestinal discomfort because remember, these are very complex carbohydrate. We cannot digest it. So something you cannot digest is going to stay in the GI. Of course, more of it can cause GI disturbances. So you always need to keep it in balance. And this is the whole idea behind nutrition or clinical nutrition balanced food. طيب انزل تحت شوي. انزل كمان. اوكي وقف لي هون شوي. هلا هاي السلايدات اوكي يا شباب خليني أوكي. هلا there's also two new concepts. انزل شوي يا احمد. انزل شوي انزل. اوكي وقف لي هون وقف. ايوه بس هيك. هلا في عندنا مصطلح enrich food يعني مش ضروري طحين فلور. في مصطلح بسموه fortified. حدا بيعرف ايش الفرق؟ يعني بتعرف حليب fortified milk او enriched خبز. هذا الخبز enriched. حدا بيعرف what's the difference between this and that؟ طيب عشان حدا بيعرف is more than welcome to say. Okay, to save some time. هل هذه حبة القمح you see this picture؟ هلا احنا فعليا لما تاكل انت white bread اوكي لما تاكل white flour or white bread you are eating this endosperm فقط عبارة عن starch okay and actually you are throwing out the whole benefit of the vitamins minerals الموجودة حواليها موجودة في الجرم موجودة في البران بينما لما تاكل انت whole wheat flour or once you recommend whole wheat flour for people trying to cut some weight or for people following a healthy regimen بياكلوا كله هذا بنطحن. سو بياخذوا البي 1 بي 2 بي 3 بي 6 الفوليك مغنيسيوم زنك، بياخذوا فايبرز اهم شيء. اوكي in the whole wheat بياخذوا فايبرز. لكن in enriched food it's okay. اوكي نطلعه بيحتوي على الحديد، بيحتوي على معظم الاشياء. so we don't get rid of the majority of benefit، بس ما في fibers. طيب شو معنى كلمة enriched food or fortified milk؟ انه خلال عمليات البروسيسنج اوف فود احيانا هالاشياء موجوده في الخبز. اوكي بي 12 هاي كلها موجوده في حبه القمح. فانت بتعمل وايت فلور. now once you add back الاشياء اللي كانت موجوده زي الفيتامين صار اسمه enriched. so actually it's enriched but هاي الاشياء كانت already موجوده. بس لما انت تضيف شيء اصلا مش موجود، يعني مثلا فيتامين دي مش موجود كثير بالحليب، لما انت تضيفه على الحليب once you add فيتامين دي على الميلك صار اسمه fortified. اوكي فهلا واضحه هاي لما تشوف شيء مكتوب عليه fortified وشيء مكتوب عليه enriched. اوكي بتمنى تكون واضحه. طب انزلوا لتحت يا احمد. انزل 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 كمان. اوكي خلينا نوقف هون شوي. هاي كمان معلومه كويسه عن لاكتوز انتوليرانس. اطلع شوي. Okay, I'm pretty sure the majority of you heard about lactose intolerance and what does it mean by lactose intolerance. Lactose حكينا هو عبارة عن دايسكرايد. اوكي لما تعرف أمثلة على المونوسكرايد والدايسكرايد والبوليسكرايد راح تعرف إنه اللاكتوز. But the problem is the patient cannot tolerate it. عشان هيك شو سميناه؟ سميناه lactose intolerance. And there's several types like this primary, secondary. بديك تعرفهم لإلك أنت. The main cause lactase deficiency. So the enzyme that break down lactose والدايسكرايد لمونوسكرايد مش موجود. deficiency either مش موجود أو بكون موجود بكميات قليلة. So what do you do in this time؟ بيجيك patient بيحكي لك أنا عندي lactose intolerance، أنا بشرب حليب or dairy food وفورا بصير عندي GI disturbances، بدخل على الحمام I start complaining cramps. So انزل شوي لتحت يا أحمد. So either you recommend lactose free or you recommend some special. انزل كمان شوية. This is the treatment you can recommend some special diet. You can remove the lactose. Sometimes they add lactase pill or some type of bacteria to break down this lactase. But remember, you also can recommend patient to know their limit. Okay, يمكن patient بيقدر يشرب كأسة حليب بدون أي مشاكل، لكن مجرد ما شرب كأس ونص بصير عنده sign and symptoms. Okay, so you can also help patient by just counseling him and educating him about lactose intolerance. طيب انزل شوي كمان يا أحمد. Okay, sugar, added sugar. Anything you add it is called added sugar. حتى لو ضفت عسل انت على طعام انت بتاكله صار added sugar. Okay, so once we talk about added sugar, there's different type of added sugar. انزل لي شوي لأحمد لتحت. بدي احكي عن موضوع. انزل عن اوكي اوكي يمكن مش موجود. بدي اياكم تعرفوا احيانا بدنا alternatives للsugar that we eat. اوكي بتسمع مصطلح sugar alcohol زي xylitol. They are very sweet and people with diabetes can rely on some of these products. They are sugar alcohol. They are not
زي
really
المينيتور وزي
yes
هيك.
yes they are not really sugar and they are not really alcohol. يعني لا هم sugar ولا هم and they have some calorie. يعني sugar
للديورتكس صح دكتور؟
yes
للديورتكس المينيتور.
بالضبط. ومش بس هيك، هلا انت 1 جرام of sugar بعطيك 4 كالوري، هذا بعطيك يمكن up to 1 to 2 calorie. يعني still you can get some. why? because they are not completely absorbed. اوكي يعني اي هم بينتهوا ب all مينيتول زايليتول. اوكي they are added sugar. فبيجيك مريض بالمستشفى بقول لك انا بضيف على الشاي هاي هذا المحلي. فانت you have to tell him okay listen there is calorie out of this. اوكي مريض سكري لازم ينتبه. لكن احيانا في السكرين في بعض المستحضرات ما فيها اي اسبارتام، ما فيها كالوري. but some patient they need to be careful. يعني patient with phenylketonuria they need to step away from what? from aspartame. and please I need you to know what راح هذا الشيء اركز عليه في الامتحان. سكرين فعليه كتير controversial بال some health issues يمكن انتم بتعرفوها. ف you will get a lot of questions from your patients. What I can use, how I can use artificial sweeteners, what is the best for me? I'm having diabetes and I'm eating sugar alcohol. Do I need to care about the amount of sugar alcohol? Yeah, of course. More of sugar alcohol also going to cause you GI disturbances because they are incompletely absorbed. موضوع الكربوهيدرات, the function of carbohydrate, the main source of energy. They serve protein, لأنه هلا أنت لما تأكل كربوهيدرات أنت بتحمي جسمك منه إنه يحط البروتينات. They are very good in metabolizing fat. Okay, in order to metabolize fat, you need carbohydrate. Remember the fibers and the advantages of fibers because fibers are carbohydrate. Remember the structural support for the plant because they are again carbohydrates. So there are plenty numerous advantages of the carbohydrate. كم بدنا احنا باليوم؟ من 40 ل 60%. اوكي، من 40 ل 60% من الدايت تاعك لازم يكون، وانا بتوقع انه you will be able to calculate قديش جرامات اذا انا بدي 2000 كالوري باليوم لشخص معين. فاحنا ان شاء الله we will recap the carbs بكره مره ثانيه لانه السلايدات ما كانت موجوده، راح نركز عليها بكره. برضه راح ارجع اعيد الانترودكشن بكره عشان نضلنا ايش نتبع هذا الاسلوب to review everything from the beginning in order to keep track with the whole material. حدا عنده سؤال بالنسبه للكاربس؟
دكتور،
يس تفضلي.
سؤال صغير. انت حكيت انه بالبداية انه الفايبرز بتعمل اللي هي بتمنع امتصاص المعادن مثل الكالسيوم والزنك. تأثيرها بالنسبة بيكون على المستقبلات انه بصير انتر اكشن بيمنع واحد امتصاص الثاني، ولا في ميكانيزم ثانية؟
No, mechanism actually by binding, how they decrease the cholesterol absorption, how they decrease the sugar absorption, it's the same mechanism. So أفضل طريقة إنه نعمل spacing, not to stop fiber because they are good for your health, نعمل spacing. Okay, so this is because they're gonna be kind of